My name is Heather. I'm with Lemons Dental. I'm one of the hygienists here. I wanted to show you guys just what we do through a person's cleaning when they come in to get their teeth cleaned. So basically we start out with the patient by taking x-rays. It's really important to get x-rays at least once a year because a lot of times you can't see what's in between the teeth and there could be a big problem lurking and we don't want that for our patients. The sooner we can find a cavity without it getting bigger, you could avoid things like root canals or crowns. So we want to try to keep decay to a minimum. After we do x-rays, we usually check the health of patients' gums. What I use to check the gums of patients is a periodontal probe. It is marked in millimeters. So basically when I'm measuring a patient, healthy tissue is considered between 1 to 3 millimeters. When it gets to a 4 on our probe, that indicates that there's some swelling, some gingivitis is happening. And when you get to a 5 or greater, that indicates that there's periodontal disease, which is gum disease. So that's active infection around your mouth, and we just want to try to avoid that as much as possible for our patients. And you can do that by maintaining regular cleanings, coming every 6 months. That's so important. So when I'm measuring Heather's gums here, she looked really good. She only had between 1 to 3 millimeters. So in her particular case, I would not recommend a deeper cleaning for her. When I do a regular cleaning, I'm using all different kinds of instruments to basically get the plaque off her teeth. A lot of times plaque can turn hard, and once it happens, we call that calculus. Calculus can be an irritant to the gums, and we want to remove that. A lot of times if calculus is left on the teeth, a lot of times it can cause gum disease, periodontal disease. So when I'm cleaning her teeth, I am removing any kind of the hard buildup, the calculus, and getting that off her teeth and from under her gum tissue. Once I'm able to remove all that plaque, I'll generally polish the teeth just to get any little bit that may have been left over. And then we floss. Flossing is really important for all our patients. Usually I tell people, get about the length of your arm. You need to be flossing every day, and if you just use a little short piece, you're not going to get around your mouth very well and it'll stay dirty. So I wrap it a little bit around my middle fingers and then a whole lot around one. That way I have enough floss to go around my mouth. So when you're done with that dirty piece of floss, you can wrap it up where you had just wrapped a little bit and unwrap some of that clean part. It's really important too when you're flossing that you're not just going straight up and down in between the teeth. You want to make sure you curve it around your tooth like this. And in Heather's mouth I will show you. You don't want to go just straight up and down. You want to make sure it gets curved around and goes up into that gum tissue. That way you're really keeping all that area clean and that tissue will be nice and happy. Healthy tissue should not bleed. If you ever bleed, that shows that there's some gingivitis happening, and that's what we don't want. So that's generally what we do with our cleanings. If y'all have any questions, you can look us up on lemonsdental.com. I hope y'all have a great day.